Hi, and welcome to today's presentation on the dating of pregnancy. Now, in our previous discussion, we said that pregnancy is the state of having products of conception implanted normally or abnormally in the uterus or elsewhere. We also said that the pregnancy may be terminated either spontaneously or by elective abortion or through delivery. Now, if this is the first time you are watching this tutorial, I would advise that you go back to our previous discussions where we looked at the introduction to pregnancy and some terminologies we use in pregnancy, as well as how to diagnose pregnancy. Today, we are going to look at how to date pregnancy. In dating pregnancy, the gestational age of the fetus is the fetus's age in weeks and days, which we actually measure from the first day of the woman's last menstrual period. Now, the developmental age, which is also known as the conceptional age or embryonic age or the fetal age, is the number of weeks and days which has elapsed since fertilization. And so, because fertilization usually occurs about 14 days after the first day of the last menstrual period, the gestational age is usually 2 weeks more than the developmental age. Now, we are going to look at three main methods which we can use in dating pregnancy. And so the first one we are going to look at is using the LMP, that's the last menstrual period, in dating pregnancy. Now, if the woman has regular menstrual cycles, then we can date from the first day of the last menstrual period. And so we classically use the Nigel rule to calculate the estimated date of confinement or the estimated date of delivery. And this Nigel rule assumes a 28-day cycle. And so we can simply add 7 days to the last menstrual period whilst we subtract 3 months from the last menstrual period. And so we are going to have plus 7 minus 3. We can also get the date by adding 7 days to the LMP whilst we add 9 to the months or 9 months to the LMP. And so we are going to have plus 7 plus 9. For descriptive purposes, I want us to look at some examples. If the woman comes with an LMP of 15th January 2019, using the Nigel rule, we are going to add 7 and subtract 3. So 7 to the LMP or 7 days to the LMP minus 3 days from the month of the LMP. And so we are going to have 7 plus 15 giving us 22 and 3 from the month of January. So we subtract backwards and we are going to get October 2019. And so the expected date of confinement for this woman will be 22nd October 2019. We can as well add 9 months to January and we are going to get 10 months, which is still 22nd October 2019. Now, if the woman comes with an LMP of 4th May 2020, we are going to add 7 days to 4 and we are going to subtract 3 months from May. And so we are going to get plus 7 minus 3 and we are going to get 11 February 2021. Now, let's pay attention over here. We must note that the months January, February, and March will have the same year of delivery. However, the rest of the months will all end up in the upcoming year. That is how come May, if we add 9 months to May, we are going to get February of the upcoming year. Let's look at more examples to make it easier to understand. Now, in this example, we have the LMP of 25th January 2020. And we must note that in this LMP, the date is almost getting to the end of the month. That is 25th January. And so the expected date of confinement moves into the next month. So we add 7 to 25 and we add 9 months from February, and so we are going to get the expected date of confinement to be 1st November 2022. Let's do it together. If we add 7 days to January, we can count it. So from 25th, we have 26th, 27th, 28th, 29th, 30th, 31st, 1st February. And so this is 7. We get 7, which has moved into the upcoming month. And so we are going to count our 9 months from February and not from January. So you must pay attention. And so counting 9 months from February, we are going to end up in November. That is how come we got 1st November 2022. Now, let's look at more examples. We are having an LMP of 13th July 2021. Now, if we add 7 and subtract 3, what we are going to get is an expected date of confinement of 20th April 2022. This is because we added 7 to 13, which gave us 20, and we subtracted 3 from the month of July, which took us back to April. That's how come we are having 20th April. And since we've said before that January, February, March, the delivery is going to happen in the same year, any month apart from these 3, the delivery is going to happen in the upcoming years. That's how come we have 2022. Sometimes if the date of ovulation is known, especially when the pregnancy was through assisted reproductive technology, then the expected date of confinement can be calculated by adding 266 days and to give us the expected date of delivery. Now, this method of dating pregnancy, however, has some limitations, especially when the date is uncertain or when the woman cannot even remember her last menstrual period. Also, if the woman has irregular menstrual cycle, it will be difficult to use the LMP. And also, if the patient conceived whilst she was taking contraceptive pills, then the date of confinement may not be accurate using the LMP. So basically, this is how we use the LMP to calculate or to determine the date of pregnancy. Now, the next method we are going to use is the use of the ultrasound. Now, if the LMP is uncertain, as we've seen that it can happen, then an ultrasound is often used to determine the gestational age and the expected date of confinement. And so, as a safe rule of thumb, we always expect that the ultrasound should not differ from the LMP dating by more than 1 week, especially in the first trimester. Also, it shouldn't be more than 2 weeks in the second trimester, as well as more than 3 weeks in the third trimester. And so basically, the ultrasonography takes measurement of the fetal parts. An example of such parts is the crown rump length, which we are going to look at. And so when we talk about the crown rump length, it measures the distance from the top of the head, which is the crown, to the buttocks, which is the rump. Now, it is taken around the 6th or 7th week of gestation up till the 14th week of gestation. Now, any measurement which is taken beyond this period may not give us accurate dating. And so, in the ultrasound, you can see that this being the crown and here being the rump. And in this ultrasound, the crown rump length was 6.51 centimeters at a gestational age of 12 weeks and 6 days. By the first trimester, the crown rump length is approximately 5 centimeters by 12 weeks. And at a crown rump length of 7 centimeters, we must have the presence of a fetal heartbeat. And so once the crown rump length surpasses or moves beyond 7 millimeters and we fail to hear the fetal heartbeat, it is an indication of a missed abortion. Also, when there is a decreased crown ramp length, it may be as a result of some chromosomal abnormalities such as Edwards syndrome or trisomy 18. Now, the second thing we can measure using the ultrasound is the biparietal, diameter. Now, this is the fetal skull, and we have the parietal eminences from this point to the other point. And so we measure the distance between one parietal bone or parietal eminence to the other. This is also seen on the ultrasound, and so we measure the distance between one end of the parietal eminence to the other. Now, it is more accurate between the 12th and 22nd week of gestation, and so we usually use it in the second trimester. The biparietal diameter grows in about 3 millimeters per week from the 14th to the 28th week of gestation, and about 2 millimeters per week until term. Also, at about 13 weeks of gestation, we may have biparietal diameter of about 2.5 centimeters, and by term, we should have a biparietal diameter of about 9 centimeters. Now, like the use of the LMP, the ultrasound also have some limitations, especially when it comes to the use of the biparietal diameter. And some of these limitations include the brachycephaly and the dolichocephaly. And so these are abnormalities of the shape of the head. And the brachycephaly is a premature fusion of the coronal sutures, and this leads to widening of the parietal bones, and so it leads to flattening of the head, and in such a case, you cannot get the correct measurement. Whereas the dolichocephaly is a relatively long, head with a cephalic index of less than, 75. And so this, when found using the biparietal diameter, may give a wrong dating. Also, presentations such as breech will also alter the biparietal, diameter. And also in multiple gestation, we may not get accurate, measurement. And so in such instances, the head circumference should be used to determine the gestational age. Now, the last thing we are going to look at when we use the ultrasound in dating pregnancy is the femur length. And so the femur length, also has, similar usefulness when it comes to the measurement, just like the biparietal diameter. And so we measure the length of the femur from the proximal femoral epiphysis, as you can see over here, to the distal femoral epiphysis, this being the diaphysis. And we usually use this in the third trimester. And so, as you can see from these ultrasonographies, at a gestational week of 36 weeks and 1 day, the femoral length was 70.5 millimeters. And if you look at the down one, the femoral length was 7.52 centimeters at a gestational age of 38 weeks and 3 days. And so by 13 weeks of gestation, the femoral length must give us approximately 1 centimeters, and by term, we should have about 8 centimeters of femoral length. Now, the last one I want to talk about is the use of the symphysiofundal height in dating pregnancy. Now, later on in pregnancy, what happens is we can use the symphysiofundal height to date pregnancy and get the actual date of gestation. And so we do this either by palpating or using a non-elastic tape measure. And so what we do is, we measure the top of the uterus to the upper border of the symphysis pubis, and this corresponds with the gestational age. And so we can use it to assess the fetal growth and development after the 20th week of gestation. Now, the fundus we are going to talk about when we measure it, but from the 24th week of gestation, things begin to match up. And so, if the LMP gives us 24 weeks of gestation, the symphysofundal height must also give us 24 weeks of gestation. There is, however, a normal variation of about plus or minus 2 weeks. That is, if the gestational age may be 24 weeks and the symphysofundal height may be 22 or 26 weeks, it's absolutely normal. There shouldn't be any cause for alarm. And so, on average, the symphysofundal height grows about 1 centimeter per week after the 20th to the 36th week of pregnancy. When we are measuring the symphysofundal height, it is important that we empty the bladder such that it does not alter in measurement. Also, what we need to know is that when we are using the symphysofundal height, this is how we measure it. You take your tape measure and you use the centimeter side of the tape measure to take your measurement, and afterwards you turn it upside down to read whatever you see. On this image, what we see is that by the 12th week of gestation, the fundus is just above the pubic bone, and by 24th week of gestation, we find the fundus at exactly at the umbilicus. However, by 36th to 38th week of gestation, the fundus is just right under the sternum, and by the 40 weeks, that is by term, the fundus drops below the 38th week level, and this is because the presenting part has entered into the pelvis. Now, like all the other methods of dating pregnancy, the symphysofundal height also has some limitations. So, what are some of the things which may influence the symphysofundal height? We have a full bladder, and when the bladder is full and we take the symphysofundal height, it may increase the height by 3 centimeters. Also, things such as obesity and uterine masses such as leiomyoma may also limit the fundal height accuracy. And so, in such cases, we have to resort to the use of ultrasonography to give us the accurate date of gestation. Now, sometimes there may be abnormal variations in the symphysofundal height and the gestational age. And so, two most important concepts that we talk about are the big for date as well as the small for date. And so when we look at big for date, what it means is that we have a symphysofundal height which is greater than the gestational age. For example, a gestational age of 24 weeks, but we take the symphysofundal height and it gives us about 28 or 30 weeks. So what are some of the causes of big for date? We have things like macrosomia, that's a big baby. Then we also have polyhydramnios, where we have excess or large abnormal volumes of amniotic fluid. Then also when the woman gets excessive weight during pregnancy, as well as multiple gestation. All of these can cause what we call big for date. What about the small for date? When we say small for date, it is when the symphysofundal height is smaller than the gestational age. For example, you have a gestational age of 24 weeks, but we measure the symphysofundal height and we get somewhere around 18 or 19 weeks. And what are some of the causes of this small for date? We have mainly the intrauterine growth retardation, as well as oligohydramnios, whereby there is relatively low volume of amniotic fluid. And so, in summary, what have we learned in our discussion on pregnancy? We learned that pregnancy is the implantation of the product of conception inside or outside the uterus. We also looked at the differences between gravidity, which is the number of times a woman has gotten pregnant, from parity, which is the number of times a woman has given birth. And we also learned that pregnancy is divided into three main stages. And so we have the first, second, and third trimesters of pregnancy. Then we also saw how to use the GPA as well as the GT-PAL system to describe the outcomes of pregnancy. Then we looked at how to diagnose pregnancy, and we said we have some signs that we use, and it includes the presumptive signs such as amenorrhea and morning sickness. Then we also talked about the probable signs such as measuring the levels of the human chorionic gonadotropin hormone, and also using signs such as the Hager's, the Chadwick, as well as the Goodell's sign. Then we saw the positive signs of pregnancy, which we said when there is a presence of a gestational sac or the yolk sac, then this is diagnostic of pregnancy. Then finally, we looked at how to date pregnancy, and we said we can use three main methods in dating pregnancy. The first one being the LMP, where we add 7 days to the LMP and subtract 3 months from the month of the LMP. And also, we said we could use the ultrasonography by measuring the crown rump length in the first trimester, the biparietal diameter in the second trimester, and measuring femur length in the third trimester. And also, we saw that we could use the symphysis-fundal height, measurement to date pregnancy. So this is all that I have for you. Thank you very much for your attention. Bye-bye.